Yeah, I feel a little intimidated now after weighing them. But anyway, you can go to the next slide. Like I've said, I'm Natalie Arendse, principal in Noorder High, and my partner is Janine Visser, and Jessica, I think this isn't the right one, but I'll do with this one. It's fine. I've done an edit, so yeah, that's why I know. We serve a very diverse community. We have, our learner total is 1,468. So our learners come from very deprived backgrounds. You can click, sir. Very diverse. Diverse cultures, religions, diverse financial status, but mostly our learners come from informal settlements, poverty-stricken neighborhoods where social challenges are rife. Teenage pregnancy, substance abuse, absent parents. We also have quite a number of learners coming from the Bekwini township, and then we serve the rural farms around Paarl, so we have 10 buses coming in with learners. They're about 470, and we also have learners coming from Klapmuts. Our principal, yeah, when I first met Jessica, and this is where we're now going to go off Jessica. But when I first met Jessica, you know, when we look at community building with Rama, the first thing that he said was, get the right people in the room. It wasn't the right people in the room. So I was quite surprised by the end of the year when she sent me a note, an email and phone, and asked if I want to be part of the Winelands 10. I grabbed that opportunity. And then when she suggested the general manager of Mediclinic, I went, okay, no, that's not going to work, because we're across the road of each other and we had a strained relationship. Our school dates from 1926, so when Mediclinic wanted to expand the parking lot, they very callously said, just move your walls. And that was a big no-no for us. But then I met Janine. It was a little uncomfortable at the beginning because we did not have the time to think or the other trainings. So the wants were quite difficult for me to express to Janine. I was appointed as principal last year, and it's either, how you look at it, it's either the best year to become a principal because it would be the worst year, or it's the worst year. I would like to think that because of my involvement with PFP, because of those training workshops, that it sustained me. I could have perhaps be derailed. There were many times that I asked questions, were you crazy? What were you thinking? But going through those training sessions really sustained me. It kept the focus, it kept the goal, and then Janine's and my thinking as a thinking pair was mostly at the beginning emotional support, and I needed that totally as a new principal. So yes, these slides are edited, so that's not actually what I wanted to speak about. In Time to Think, I think the quote that stood out for me, I will never forget Alison's words, was delicious attention. In our context of principalship, there's never time. So when you want something to be done, you look at time and you bring the solution and all of that. And with Time to Think, I've realized you can't do that. I'm a to-do person. I must learn to delegate more. But that really stood out for me, that I really need to give attention to that. The other thing about Time to Think that I will carry with me is the round. So we have 42 teachers on staff. That's a big room. And there was a little dissent when you become out of staff, the principal, and there's always a group that challenges and resists. And taking it to the smaller group worked for me. So I really took that to the SMT and enabled the SMT to first take it to the smaller groups. So our SMT is grade heads, and then they also HODs. So that was something that I will carry with me in my toolbox. When it came to Rama, something that I will carry along in my toolbox, and we also have it with Janine, and it took a long time for me and Janine to connect, was we serve the same community. We actually one community, Mediclinic just being across the road. And definitely with that would be to listen, to keep quiet, that everybody brings value to the table, no matter if it's the caretaker or the deputy or the general manager of Mediclinic. We can all bring value to the table. And I would like to believe that with the community building, that we need to find the common ground. And so our partnership at the beginning, we struggled a little bit to just put our goals down, but now we have it and we're now going to run with it.
Good afternoon, my name is Janine Visser, as you heard. So I was introduced to Partners for Possibilities before I committed to join, and I think it's about 2 years ago when Jessica first started asking me if I'm willing to join the program. At that time I told her, sorry, I can't, I'm busy with a building project. And when she came to me the next year, I knew she's not going to leave me alone. So I have to. And I said to her, yeah, it's fine. Our building project will be completed by then. And then COVID came. And COVID made that our building project was extended. So it was hectic time. So when Natalie say it's about us challenges with the connection in the beginning, it was all about the fact that I had no time and she had no time. She was a new principal and I had a building project and I had the COVID pandemic to manage. But we got through it and we got stronger. So I'm not going to bore you with the detail of what I've learned. I made a few notes there. If I can highlight 2 or 3, it would be to be humble and not to judge. And also that leaders need to lead with shining eyes. It's all about, even now that you're wearing a mask, people are looking at your eyes, and if you don't smile with your eyes, what are you portraying? So that is very important. The relationship with Natalie was a great learning for me. I was in school when I was in school, and that is what I knew about school. And then my children went to school, but when Natalie started explaining to me the different structures, and it's hectic. And I have got a lot of respect for a principal since the beginning. So initially our focus changed because I had to support her emotionally. It's difficult to be promoted in your same school to a principal, the same as being promoted at the hospital, where people now need to have respect for you, and you've got your challenges all the time. So during the COVID pandemic, we spoke a lot. We did Zoom. We Zoom over weekends mostly because I had no time and she had no time. And it was a struggle, but we got through it, and we got to a schedule where we said we need to commit, we need to meet at least once a week, and if we can't meet on the Saturday, we postponed it to the Sunday or the Monday. But yeah, we had a positive engagement, and I'm very excited about the way forward because she's my neighbor as well, so we're just across the street. We walk to each other for meetings now, and we don't only do Zoom anymore. Zoom is obviously an easy escape route, but you also need to meet with each other in person. You can go to you left, okay. So if we look at the section that we brought us together, we agreed on certain values that is important for us. Openness, honesty, commitment and care. We had open discussions, we had to understand each other's challenges, personal and at work. And we created a safe space to discuss challenges that we have at work, and we knew that it'll be a confidential discussion. shared lessons that we learned. And although time was a challenge during the COVID, we first had to understand the environment. So I orientated Natalie on what we did to prepare for COVID, because obviously we were prepared before the school had to prepare for the COVID or the opening of the school with COVID. And then we started reviewing the challenges that we initially identified and said, so what can we use going forward to support the school? Next slide, please. You can continue. So what we did was, I gave her emotional support. We assisted with COVID safety to make sure that there's enough guidelines regarding COVID guidelines, as well as operational challenges with her team, where they did not want to open the school and where they did not agree to the extent to what the department actually forced Natalie to open the schools. Certain of her senior management team members gave her a lot of trouble. So I supported her in that, and I told her, you know what, we did it. I can tell you what we did, and let's see how we can assist you to plan for a new normal in the school. We're also busy with the building project, so there's a lot of furniture that's replaced with new furniture, because there's a new mediclinic that they're creating in Paarl, so they don't want to use the current furniture. Some of the furniture there's nothing wrong with, it's just old. So I asked Natalie, and she was so grateful for that, because I knew that she had challenges in her own office, she had challenges in her staff room. So yeah, we were grateful.
I was excited. It's beautiful.
Excited, yeah. And we also had vegetable donations. You know what? It was a great experience for us during the COVID, how the community supported the hospital and the staff. So every now and then somebody contacted me to say they want to bring the staff, whether it was cupcakes or whether it was fruit or whether it was vegetables, right through the pandemic. And the staff was so grateful for that. They actually started fighting about it, because in some instances we got little stock, so we could only give certain departments, and then they hear about it and then they want to know where's ours. So, but we could also share with Natalie, because I know she's got the feeding scheme, so we could support her as well. And what we plan to do going forward is to continue our or strengthen our partnership, improve the morale and teamwork of the teachers as well. And we also want to support business in the community to grow the future talent of the school, the pupils. We want to have a career day at the school, where we want to share with them in a medical environment what positions are available. Also some workshops on family planning, contraception, HIV, COVID, all of that. So there is expertise at the hospital that I can avail to make sure that we grow the information to the school as well. How we will do it, we will have monthly check-in sessions, and we will increase the community and business involvement through networking, and also share training tools to the rest of the teacher team. And obviously the communication to parents is very important, so I will support in there. We've learned a lot through COVID at the hospital on how you need to make sure that communication filters through right to the cleaner at the hospital. So these are just a few photos of where we started. We had some breakfast meetings, we delivered the furniture, and then also the food project. Next slide, please.
Is perhaps because we are high school, we would like to invest in the future after matric. So creating a possibility for our learning communities, if they come from these difficult challenges, they don't dream. So we want to keep the dream alive, and for that we need to contract and recontract and work in our thinking pairs. And I'm very grateful that for the business partner, because she's outside the school, she looks with different eyes. We look with educator eyes. So what we thought about, especially for our grade 11 and matrics, is job shadowing, career exhibition, other than just being a doctor and nurse in Mediclinic itself. And then I've said about the challenges, so substance abuse is rife in a school like ours, teenage pregnancy, and Janine said she would tap into her network of service providers so that they can come have talks, and also extend it to parents and parent responsibility. So the girlie there on the picture, that was a year ago, and she had 4 A's across in a matric exam, across 4 subjects. Thank you, ma'am. Yeah, so
we would like to say thank you. It was very nice, Jessica. Thank you to you. Thank you for your patience. Thank you for Partners for Possibilities. At the end of the day, the both of us were strengthened by the program and grateful for the family that we met, and looking forward to a relationship growing strong in the future.